Okay, question number 7. A 30-year-old man is brought to the emergency department with complaints of fever, 106.7, and diarrhea for the past 12 hours. There is no history of headaches, vomiting, or loss of consciousness. The past medical history is unobtainable due to a language barrier, but his wife says that her husband had a motor vehicle accident when he was a teenager that required surgery. He is transferred to the ICU after a few hours in the ED because of dyspnea, cyanosis, and near collapse. There are no signs of meningeal infection. The blood pressure is 70/30 at the time of transfer. Chest X-ray shows interstitial infiltrates without homogeneous opacities. The initial laboratory results reveal metabolic acidosis, leukopenia with a count of 2000, thrombocytopenia, and coagulation profile suggestive of disseminated coagulation. Peripheral smear was performed and is shown below. Okay. Despite the ventilatory support, administration of intravenous fluids, antibiotics, and vasopressor agents, the patient dies the next day. Gram-STEN reveals gram-positive lancet-shaped diplococci occurring singly or in chains. Which of the following is the organism? I don't think there is any image attached. So yeah, this is the description of the bacteria: gram-positive lancet-shaped diplococci occurring singly or in chains. Okay. So they have given the answer as Streptococcus pneumoniae. We'll go through the question and find out how. Firstly, when you read the last line of the question, it gives out very well, like it's pointing at you that a gram-positive lancet-shaped diplococci occurring singly in chains, which is very, very, very specific for Streptococcus pneumoniae, right? So now when we go through the question, I'll tell you, you can see there is high fever and diarrhea, okay, which is not very specific. It can be present anywhere. And one more thing, if people must have noticed, there is a history of motor vehicle accident that required surgery. So maybe they are talking about some kind of spleen injury. So the person might have had a splenectomy. All right. So that is why that it has increased his risk for splenectomy. Increases the risk for which kind of bacteria? Quick names, fast. Any 2 or 3 names you give me in the chat box. I'll wait for 5 seconds more. I need to know which bacteria. Okay. Very good. The capsulated bacteria. So I have got the answers as Streptococcus pneumoniae, H. influenza, and Neisseria meningitidis. All 3 are over here. So it's given in the question. You can rule out all of them. So chest X-ray was done and showed interstitial infiltrates. Okay. This is pointing towards Streptococcus pneumoniae, right? And then there is a severe picture as disseminated coagulation and all that stuff. All right. And somewhere it is written that the no sign of meningeal infection. So that's how you could rule out Neisseria meningitis. Okay. And as I mentioned, asplenic patients have an increased risk of encapsulated organisms such as Streptococcus pneumoniae, H. influenza B, and Neisseria meningitidis. Okay. So that is why they have to be vaccinated properly for this. And one more thing is, someone asked me why H. influenza, because the H. influenza strain which they have mentioned is unencapsulated. Okay. They are mostly responsible for mucosal infections such as otitis media, conjunctivitis, and bronchitis. Okay. And they do not pose any increased risk. It is the encapsulated bacteria, not the unencapsulated. The unencapsulated refers to non-typable H. influenza which do not have a capsule around them. All right. Is it clear to everyone? Were you able to rule out? Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.